I apo-
Hey shifters. Whoops. I just dropped something here. Hey shifters. Welcome back to another episode of Make the Shift, a mini series podcast. This is the fifth episode, and I'm not going to tell you anything about it. Just kidding. So shifters, thank you for tuning in week after week to the Your Next Shift podcast, which happens every Wednesday, where we interview nurses and nursing students and retired nurses from across the country to hear about all of the unique and diverse things that nurses get into, which is to say that you, the nurse, have opportunity to make changes, to make shifts, to go for what you want in terms of your nursing career goals. That podcast continues on, as I said, Wednesdays, week after week. And this is a spinoff, a mini series. So here we are, fifth and final episode of 5. Now, I've been speaking with Johnny about the topic of health coaching. We, in the first episode, really dived into what a health coach is, how nurses are perfectly positioned for this work. Secondly, we talked about chronic illness. And actually, Donna shared a very special story about the second client she coached and some amazing outcomes. We were both so excited. I was like, I want to be there too. And then third, we talked about education, legalities, things that might block you and get in your way, and telling you, just get started. Fourth episode talked about money, and business, as you know, we need to make that money in order to sustain a business. Otherwise, we're in it for a passion and hobby. Here we are. As I said, I wasn't going to recap, but I felt like that would not be fair to you. So we are back here for the fifth and final episode of the mini Make the Shift series. All of the information can be found at elizabethscala.com/health coaching. So here we are, Donnie. We don't want to go it alone. You know, nurses struggle. You know, I raise my hand here. I'm going to raise my hand and say I do the same thing. I was sick a few weeks ago, and what do? I just try to do it on my own. So we struggle with this topic of asking for and getting some help. Now, I don't know why it is. That's a whole nother topic for another podcast. But can we talk a bit about what you were mentioning in the previous episode, the affiliate program, and how that makes your business easier?
Yes. Well, we talked a little bit about how we can lose the forest for the trees when we try to start a business. And we're focusing on a logo, and we're focusing on business cards, and we're trying to get a website up. And we don't have all of the core elements of a business, which is we don't have a service, we don't have a curriculum, we don't have a program, we don't have something that we are offering. We don't have clients, and we're not making money. You can spend years on the logo, business, the website, and all of that, and not have a business. And so I absolutely love that I use a system that is literally plug and play, where it provides you with some of those basics, okay? And as we talked about as well, as a nurse going through nursing school, I never took any business classes. And so I love being surrounded by the resources that I need in terms of building a business, in terms of learning how it is that I find clients and all of that, in terms of having a program to offer. And so I use a very, very simple system that is plug and play that somebody could start coaching today. Because once again, this is a lot of review, isn't it? But as we talked about in a previous episode, as nurses, we are very qualified to help other human beings.
You know, you mentioned some of the benefits of this simple plug and play. I love that term, plug and play. It makes me think it's going to be fun right off the bat. You've already been alluding to kind of the benefits, but let's really highlight the 3 specific reasons that you're involved in the business model. What are the 3 reasons you enjoy it?
Well, number 1 is because I can deliver results. I have an evidence-based program that, number 2, I don't need to reinvent the wheel for, okay? So the first question is, I can use an evidence-based program. I ran a Fit Kid Club as a nurse practitioner, and because I took the initiative for that, I had to propose the program. I had to create the curriculum, and that took several months. And during that time period where I was coming up with the proposal, with the risk that they would deny it, right? Coming up with the curriculum, nobody was getting helped. And by having something that's in place, that's already been tested, been evaluated, been studied by Johns Hopkins and NIH, as a health professional, I love knowing that it works. Because the one that I took forever to do, I didn't have that kind of evidence. I just hoped that based on all of my research that I was putting together something that would work. I had a good hypothesis, right? And so I love that with this, by using an evidence-based system as a health professional, that means a lot to me.
Mhm. I think that the shifters listening, my goodness, these days in nursing, everything is about evidence-based, myself included. You know, when I think about some of the work that I do online and I'm like, why isn't this working? Well, because there's no research yet behind it, you know, and as nurses, we want to see the evidence and know that what we are going to be involved in is supported by data. So that is amazing. And that speaks volumes to our profession. So that's fantastic. Now, you talked about the fact that there is support available and how you're going to help the health coaches get up and started and not be bogged down by seriously just the minutia that can be involved in starting up a business. So what types of support do the health coaches get in the system, your system?
Well, not only do they get the one-on-one mentorship with me, okay, where I work one-on-one to help them achieve whatever business goal that they have. We talked about how people can maybe want just a part-time income, and sometimes they want a part-time job, or sometimes they want a full-time income, and maybe sometimes in part-time hours. But I provide them with that. But in addition to that, because it's a plug and play system, it has the curriculum and the education built in. There actually is a book and a workbook that we guide our clients through. And whereas my weight management consultations as a nurse practitioner were about 45 minutes long, I now don't have to have those long consultations because there's a resource that I could put in the client's hands. It's a tool that they have that kind of covers all of the habits of health, the things that I want to empower them with, the sleep, the stress management, the drinking of water, the nutrition, the activity, all of these things. And it doesn't have to depend on me knowing it all or me teaching it all, which means that it frees up some of my time. And it also empowers the clients. Another set of resources that are available to clients is that we have access to nutritionists and we have access to personal trainers and physicians and nurses, so that if there are any medical questions, that we can connect them with the proper resources. Mm-hmm. Every week there is a habits of health class, if you will, okay? Completely virtual online. And so once again, that increases compliance because it's simpler. What we do when it's plug and play is we lower the difficulty level or the threshold of difficulty, not only for the provider, but for the client. So they can access this class from their phone, from their computer, from wherever they are, or they can listen to it as a podcast, okay? So it's something that is very easily available. And as the business owner, I don't have to get lost in the minutia of planning and preparing a talk every single week, which, you know, a 30-minute talk can easily take 2 or 3 hours of prep time. Mm-hmm. And so since I don't have to be the one to come up with that, once again, it frees up my time so that I can focus on either high leverage activities, which are the activities that generate revenue, right? Or I can focus on the high pleasure activities, which are important to me, which are being with my family, you know, being at the playground or whatever, homeschooling, the things that are really, really important to me. And yet I'm able to offer an incredibly very comprehensive system that if I were to kind of reinvent the wheel, if I decided, like you said, I want to just do this on my own, and I want to hire a personal trainer and a nutritionist and a physician to be on staff on retainer, you know how much my overhead would be?
My goodness.
So it's nice that I have all of these resources available to my clients, to myself, at no additional cost to me or to them. And so by using a plug and play system that is evidence-based, it really answers the question that you asked a couple of episodes ago, which is, how is it that a health coach is a little bit, you know, how is it that this helps nurses get back to the heart of nursing, which is, I want to do more for my clients without having to sacrifice my life, right? And so when you have a system that works, and you have a system that allows you to get paid, that's another big reason I like. It makes it very, very accessible to clients, and I get paid well. then it frees up my time so that I can do the things that are important to me while making a huge difference in the time that I'm actually working.
That's amazing. So I love how the materials are there, the support is built in, there's that flexibility for the nurse who's now the coach. And, again, evidence-based is amazing. And then we don't have to reinvent the wheel and come up with the stuff that's going to work for the client to change the behaviors they're looking to change. They get the outcome that they need. So you talked about all of the reasons you love this, but I'm just curious, how has health coaching changed your life? I mean, if you had to boil it down to the number one reason why you'd recommend it, what would you say?
Because it keeps me on track. It reminds me to take care of me. Because as a nurse, I needed to put my own health on the back burner to take care of someone else. And as a health coach, because now people look up to me. And so it keeps me on the straight and narrow in terms of taking care of myself. So instead of putting myself on the back burner, it actually makes me puts me in the spotlight. And one thing that I never really thought about was how what I spend most of my time doing affects my health. And, the way I feel about what I spend my time doing. And so not only has being a health coach kept me on the straight and narrow in terms of me getting my exercise every day and me trying to eat right and me trying to get my sleep. I am far from perfect. Do not get me wrong. I'm not trying to suggest that I am. But the fact that I'm a health coach keeps me trying, keeps me striving. And the fact that I love what I do as much as I do, and the fact that it gives me the flexibility to be with the things and the people that are most important to me, it's all about me. If I'm going to be honest, it's all about me.
Well, if you didn't have you wouldn't have your experiences right now. You wouldn't have the ability to help the people you're helping. And I say this all the time to nurses, being sort of focused on self helps us help others and be selfless. There's no way to be a nurse if we are exhausted and feeling drained and tired and miserable and downtrodden and just emotionally upset. I could go on and on. I agree. I mean, I talk about self all the time and I'm like, it's not selfish. It's selfless. It's amazing. So I'm not going to go on a rant here. I've said this before. I'm going to say it now too. Health coaching sounds like a perfect complement to being a nurse. And I'm so excited for the shifters to make the shift, jump into this coaching with you. How can they begin today?
Just go to elizabethscala.com/health coaching.
Excellent.
And we'll take it from there.
Excellent. Donnie, well, thank you so much for your time for these 5 series episodes of Make the Shift. Thanks for sharing this information with the shifters. I think this is a valuable resource, and I'm positive shifters are receiving benefit. And thank you for doing what you do for yourself and for all those clients that you're coaching. Appreciate everything you've shared with us here.
Thanks, Elizabeth.